The lung cancer screening programme is a national programme, a national process of work where we're essentially going out and trying to pick up cases of lung cancer, but specifically more cases of early stage lung cancer. We know that lung cancer is quite hard to pick up at an early stage, but the earlier we can pick it up, the more treatment options we have, and specifically for those very early stages of disease, we can effectively offer curative treatment. Unfortunately, at the moment, that's not the case. We tend to see lung cancer quite late, and that limits what we can do about it. By effectively going out into the community, into primary care, and offering a specific population, an at-risk population, the invite to come and have a targeted lung health check and possibly a CT scan, we know that by doing that, we can significantly increase up our pick-up rate of early-stage lung cancer and therefore improve outcomes for those patients. So the benefit of finding any cancer early is that it increases your treatment options and it significantly increases the chances of curing that cancer. At the moment, we know 7 out of 10 of our patients are presenting at a later stage. That doesn't mean we can't do anything about it, but it means we're more limited. Whereas if we can bring those patients forward and diagnose them earlier, we're then able to offer them more radical treatment options in terms of things like surgery and radiotherapy, which we know can have a really good cure rate. The National Lung Screening Project is aimed at those patients aged 55 to 74 and smokers or ex-smokers, so anybody that's ever smoked essentially. Now at the moment we're accessing those patients through primary care, so predominantly GP registered patients because that's how we find out who they are. But increasingly we're also doing work into a more difficult to reach populations, perhaps those that aren't registered with their GP or don't go to their GP quite so much. So for example, the traveller community, the Fisherman's Mission, we're starting to do lots of work with those and actively trying to find those patients as well. Essentially, if you meet the criteria and we get the details from primary care, the lung screening team based in the Trust will contact you. They will offer you the first step of the process, which is what we call a targeted lung health check. That's effectively a questionnaire, a tool that we use to find out a little bit more about you and your lung health. That gives us a lot more information and gives us essentially a degree of risk of lung cancer. The second stage is if you meet a certain level of risk, then we'll offer you a low-dose CT scan. So a very safe CT scan, doesn't involve any contrast or blood tests, and that's the second step. Obviously then you've had your scan and there's various outcomes from that. So obviously if it picks up a cancer, we will just bring you in and see you as soon as possible and sort that out. If it's normal, then we'll let you know that it's normal and we will then offer you another scan in 2 years because we're going to follow these people up over several years. And then there's an area in between where it doesn't show cancer, but it may show other incidental findings, all of which are really important to find out about. It might be something like heart vessel disease or emphysema or anything really, but all of those things, we've got processes in place now where we can put you in touch with the right person or get you on the right treatment for all of those incidental findings.
The main reason to attend for the test and the check is to find any signs of lung cancer, but sometimes we do find other problems which also then can be addressed with the doctor or with the hospital. The screening's being rolled out across the whole of North East and North Cumbria, and we're doing that progressively through each practice in the North East and North Cumbria. It might not have reached you yet. If you haven't been invited and you think you should have done, check that the GP has the right details for you, and there are ways to contact the screening programme if you think you could have been invited. So the screening programme is for people who don't have any symptoms. So if you have any symptoms that you're concerned about in your chest, it's really important you speak to your GP about that. So the kind of things that you should always get checked out with your GP are if you've got a cough that's not going away, if you're coughing up any blood, or if you have persistent pains in your chest, go and speak to your GP about that first. The most important thing you can do to reduce your risk of lung cancer is to stop smoking. And there's lots of help out there to help you to do that. Contact your GP surgery for advice or go online to find the smoking cessation service. If you've already stopped smoking, it's really important still to look after yourself and stay healthy with healthy diet and exercise. And if you have any symptoms in your chest that you're worried about, speak to your GP.